I am Loren Cunningham Hammonds. I am one of the trainers here at National General Accident and Health, and I am super excited to be able to introduce to you guys our new Senior Indemnity product. Now, I'm going to go into some details. Now, if you guys, of course, have questions, hit me up in the chat, and as we progress, I will answer the questions. Now, there have been a lot of requests for this material, and I will show you my email address at the end of the presentation. And please, by all means, email me. I'm more than happy to shoot this over to you. So let's go ahead and get started, guys. Okay, so we're going to go over the why fixed benefit indemnity plans, as well as the new senior indemnity plans. We have the plan options. There are 5. Yes, guys, 5 plans to offer. We're going to touch on the plan detail as well as resources. Now, these resources are for you, the agent. I think this is a great opportunity for you to be able to touch base with your client. You know, if they were kind of on the fence about a product that they might have wanted, well, I'll teach you how to go in and teach them how to navigate, find a doctor, get that ID card. So again, I like to utilize this, and I stress it. There's a great touch point for you, the agent. So why a fixed benefit indemnity plan? Well, unfortunately, in 2019, the American senior aged between 65 to 84 spent an annual average of $16,872 just for healthcare. Now, unfortunately, costs are rising, unfortunately. So healthcare spending for people on the Medicare spectrum, unfortunately, is going to go up significantly, like $19,029 by the year 2027. Guys, super scary. That's only 5 years away. Super scary. So for those of you who have insured that are, watching every penny, this plan is a great option. Now, between 1991 and 2016, the bankruptcy filing rate for Americans between the ages of 65 and 74, unfortunately, increased by 204%. The majority of the reason, it was fueled largely by those higher health costs. Because remember, guys, unfortunately, inflation, healthcare is going up. So again, this is a great product to buffer that for your insureds. So the fixed indemnity plans are an affordable, predictable way to get help paying for that healthcare. So the fixed indemnity plans are going to help to cover that anticipated costs of everyday healthcare services. It's going to pay a set dollar amount for certain covered healthcare services. So this is going to pay the same benefit regardless of the amount the provider charges. So for some of us that live on the Pacific Northwest, the charges for, like, say, a broken leg might be different to the people that are in Georgia. So again, whatever that set, we're saying a set dollar amount, period, done, end of story. So unfortunately, your insured would have to pay the balance if that's applicable. Clients are going to pay any charges in excess of that plan benefit, just as I was saying. So if there's a difference, they're going to pay it. But this can also help offset that cost. So the new fixed benefit indemnity plan is going to offer senior clients affordable and predictable access to that healthcare. Now, remember, guys, this is an indemnity plan. This is not an Affordable Care Act plan. This is an indemnity plan. We have 5 plan options. So we have 2 base plans that are going to help cover that out-of-pocket expense that the primary plan does not. And then we have 3 max plans, which are much more richer, more robust benefit that are unique to the marketplace. Now, highlights. So the indemnity benefit for sickness covered right away, but there is a 90-day waiting period for that preventative. Well, what do you mean by preventative, Loren? So, those colonoscopies, mammograms, things that your insured goes into the doctor for on the annual physical checkups, those more extensive tests. Unfortunately, there is a 90-day waiting period from when the policy goes into effect. Benefits for the office visits, urgent cares, of course, laboratory services, we have those benefits. We have a tier 1 and a tier 2 surgical benefit. We'll go into more detail. Up to 31 days of hospitalization per plan year. Now, guys, I'm going to dive a little deeper into that, so don't worry. So our base plans are going to offer a lower level of coverage. So they are a great option, for those seniors who are looking to supplement their Medicare Advantage plans or even Medicare supplement plans. Now, our max plans, remember I said it was a little more robust benefit. So these are a great option. Say you have that insured that missed their initial enrollment window when they turn 65. So that ICEP, that 7-month period, 3 months before their 65th birthday, the month of the 65th birthday, and then 3 months after. Well, if they didn't do anything, unfortunately, they're bad, right? They're kind of stuck. Well, you can take care of them with this plan. If you have that person that needs to bridge the gap between early Medicare enrollment in January and their plan isn't effective until July. So again, that bridge, we are seeing that some seniors are retiring earlier than their 65th birthday. So again, this is a great option to fill that gap and then use it as a supplemental plan on top of their Medicare Advantage or their Med Sup plans. Unfortunately, people that aren't eligible for Medicare, whether they're new to the country, they don't have that 40 hours, 40 working credits, 40 quarters in order to qualify for Medicare. Great, guys, you can take care of them still. Let's say you have that insured that unfortunately lost their plan B. Yes, it happens more frequently than you realize. If that's the case, again, this is a wonderful offering for that insured. So let's talk about the plan benefits, and then we're going to talk about the new Senior Life Plus. So the Life Association has been revamped just for this populace. So let's kind of touch into it. So for the inpatient hospitalization, now, again, as you see, we have those 5 benefits that we were talking about. 1, 2, and 3 max plans, and then the base plan. Now, remember, the max plan is a more robust plan offering. So for the sake of time, I'm going to kind of focus on the plan 3. So you'll notice that with hospital admission. Now, guys, please make sure your insured understands they must be admitted. Unfortunately, if your insured is there for observation, this policy is not going to pay. So they must be admitted. Key point. So they're going to receive a $5,000 payment for an admission into the hospital. But please note, there is a 2 max admission per plan year. Hospital confinement for sickness, excuse me, $1,000 payment. Now it's 31 days of confinement per plan year. So if you have an insured that's been in the hospital for 18 days, they will then receive $18,000 in addition to that $5,000. Daily confinement for injury, again, $1,000 per confinement. And then it's the plan benefit max is 31 days per confinement. Now, remember how I was kind of talking about that tier 1 versus the tier 2? So let me give you examples of tier 1 versus tier 2. So tier 1 would be like amputation, excluding hands, fingers, toes, But if a limb is amputated, they would then receive a $5,000 payment up to 5 surgeries per plan year. Let's say heart valve replacement, spinal fusion, hip replacement, the appendix, if the appendix is removed. So basically, if it's a much more riskier procedure, that's how I like to view it, then again, that is going to fall under a tier 1. Now you'll notice that under the tier 2, it's not as robust because again, it's not as risque. So if it's an outpatient, more than likely it could fall under that. But again, it depends on how a doctor codes this. This is not up to us how it's coded. So tier 2, $2,500 payment. And then again, it's maximum 5 surgeries per year. Now, let's say you have that situation where you have an insured that's gone in and they've kind of sort of had 4 or 5 surgeries in one surgery. Unfortunately, because we would then treat it as one surgery. So it's not, 5 procedures because it's all one surgery. So keep that in mind to make sure insureds understand that. Now, if they have a surgery today and then a week later, there's another surgery, okay. Transitional care. So guys, look, I'm so excited about this. We actually do have a benefit for skilled nursing facility. So your insured would receive a $250 payment per day for 60 days again, and that's per plan year. Now, the outpatient. So let's say that your insured goes into that office visit. Well, under the tier 3, it's a $75 payment, and that's 2 visits per year. The preventative care, remember again, guys, there is a 90-day wait period from the effective date for them to utilize the preventative care options. So $100 payment twice, 2 visits per year. Urgent care facility, again, $75 payment, and again, 2 per plan year. Now, radiology and laboratory. Again, we're going to focus on the tier or plan 3. I want to say tier 3, but it's plan 3. So radiology is a $50 payment, 2 tests per plan year. Laboratory, again, a $50 payment. Again, for that plan year, 2 tests. Now, emergency. Yes, guys, I'm excited to point out we have air ambulance. Yes, but you'll notice it on the base plan, not a covered benefit, but ground ambulance is a $500 payment, 2 trips per plan year. Air ambulance, $5,000. Now that is 1 per plan year. Now emergency room, you'll see on the max plans, the 1, 2, and 3, not a covered benefit, but on the base plans, it is a covered benefit. It's a $50 payment per trip, 2 visits per year on that plan year. Now our senior life, my Senior Life Plus Association. So more robust benefits, more robust discounts for your insureds that are part of the Life Association. Now, remember, guys, we have that Telemed for Life. Telemed for Life, in my opinion, is super vital, especially right now with these COVID numbers going up across the United States. So your insureds can connect with a doctor via phone or text 24 hours a day, 7 days a week from the comfort of their home. Unlimited consultations. Remember, there is no extra charge. Some other insurance companies will charge a $50 copay. Us, nope, it's built in. They can call as many times as they want. We also have the Better Living Now Diabetic Services as part of the Life Association for the Senior Plus. So it's discounts on durable medical equipment, as well as the disposable medical supplies, nutritional supplements, a lot more. And with a lot of them, there's no shipping charges. That's huge. That's huge. We also have the dental, vision, and hearing. So again, when you're insured, takes one of the policies and has this Senior Life Plus, they're going to receive a packet. And within that packet, it shows all the discount programs. So please know that your insured has to stick within those networks to receive those discounts. And again, discounts, dental cleaning, procedures, eye exams, glasses, hearing tests, and even those hearing supplies. Discounts. My husband wears hearing aids. Yes, my husband wears hearing aids. So we get a discount on his batteries. And considering his batteries last about 7 days, we go through batteries pretty quickly. So, everything adds up, guys. Other discounts included chiropractic and alternative care services. So acupuncture, if you have insureds that are into acupuncture, there could potentially be a discount for that. Podiatry services, lab services, as well as the screenings, gym memberships. Yes, guys, we offer a wide variety. So again, remember, when you're insured, sign up for the Life Senior Plus program. They're going to get a huge packet with all this information in there too. So we're going to talk about the eligibility, state availability, some limitations and exclusions, because there's always those limitations and exclusions. And then we're going to talk about the enrollment and the payment. So eligibility, well, the primary applicant and spouse must be between the ages of 65 to 74 at the time of application. Guys, yeah, we can add a dependent child on that plan also up to age 26. These plans are renewable up to age 85. Now, please note, it does require your client to fill out a health questionnaire. So if you have that insured with diabetes, unfortunately, no, even pre-diabetes. We looked at this for a dear friend of mine. He's diabetic. He is diabetic. He's in his late 60s. And unfortunately, no. Remember, there is still health questionnaires. Please note, no child-only applications here, guys. Current states that this product is available. Now, remember, guys, we only launched this product 2 weeks ago. So we're going to be adding states as time goes on. So, you can always check in and double check as to when and where more states are available. Now, please note, I don't know what new states are coming, but, check back. Limitations and exclusions. So we have those pre-existing conditions, unfortunately. Dental services, routine eye exams, and routine hearing exams. But remember, with the Senior Life, you have the discount program. We also do not cover cosmetic services, weight loss, treatments for chronic pain disorders, injuries sustained from hazardous activities or occupations. So, alligator wrestling, bungee cord jumping, parasailing, rock climbing, those kind of hazardous activities. Again, occupations that could be like the gentleman that works on the bomb disposal squad. Nope, sorry. Please note mental illness and substance abuse. Now, this also pertains to rehab facilities. So chemical dependencies, whether it's alcohol or drugs, again, not going to be a covered benefit. Outpatient prescription drugs, unfortunately, guys, not a covered benefit. Now here at National General, we can write that policy from anywhere from the 1st of the month through the 31st of the month. You can write this policy as soon as tomorrow effective if need be. So if that's the case, remember the initial premium payment has to be any date between the time of application, but it must be paid before the effective date. So reoccurring payments are 5 days before the monthly anniversary. So if Russ were to write me a policy effective, say tomorrow, the 18th, going forward, my monthly anniversary would then be the 15th of the month. Acceptable forms of payment are going to be the checking or savings account, Visa, MasterCard, or even a Discover card. So let's talk about the resources. Now, again, I'd use this as a touch point so you can walk your insured through where they find that ID card if they need it. So if you go to our webpage, which this is what it is, it's bright, it's beautiful. That's my opinion. natgenhealth.com, this is what you see. Now, if you click on the agents tab, you will see that there is the agent tools and information. So let's say you need a refresher on this here course. Well, you can click there and you go to our YouTube page. The area that I like to point and spend more time on is the marketing materials. So marketing materials, this is where you're going to find those plan brochures. Let's say you need more detailed information on those limitations and exclusions. You can find that in the plan brochures, as well as flyers, trifolds. Trifolds are my favorite because did you know that you can download the trifold in a PDF, type in your particular agency's information, save it. You can email it to a client, or if you want to print it out in color and present it, if you're doing the face-to-face, it's all there for you guys. So you don't have to go off and pay extra money. It's all here, just click, click, click for you. Now, existing clients. So when you've sold the policy and your insured has went in and they've done their e-signature, that's fabulous. But let's say that they need to double check, or you want to check if a particular doctor is within a network, whether it's our dental programs or short-term medical. Well, you can click on the Find Doctor and Facility and search there. This is where your insured can also view the general policy documents if they need to submit a claim for this senior indemnity. Now, remember, guys, senior indemnity plan, this is a fixed benefit, set dollar amount. So when your insured gets that bill, they are going to need to submit a claim for that payment on the indemnity. So yes, for those of you that are new, welcome. Your insured will then, all the EOBs, everything is set up after they've, say, been admitted to the hospital. They're going to get a bill. Hopefully it's itemized, makes things a little easier. Itemized bill, go in here, either you or your insured can submit that claim. I would use it as an opportunity to touch base, but that's me. If your insured needs to view those policy documents, they can go to mynatgen.com. Now, remember how I said, once you've completed that application, well, your insured is going to receive an email. Once they receive an email, it's going to bring them to the member portal. So this is what the member portal looks like. So in the member portal, they're going to create a password. They can always come back to the member portal. So mynatgen.com, put in their email address, their password. This is where your insured can view those policy documents if they need to print out a temporary ID card. Because remember, those permanent ID cards will arrive in the mail anywhere from 10 to 14 days after. Say they want to check the current policy documents, their payments, say they want to change their payment methods. Again, member portal is where that's going to be done. So really quick recap here, guys. We have a set dollar amount to help with those healthcare costs. There's no waiting period for that sickness. Now remember, 90 days for preventative waiting period. 5 benefit levels designated to meet specific needs. Pick any doctor, any hospital. It's easy to use and easy to understand. And again, guys, that My Life Senior Plus members, the benefits, it's very robust. Now, guys, why NatGen? Well, we have roots to go all the way back to 1939. We were given an A+ superior rating by AM Best. We specialize in both the short-term medical as well as the supplemental insurance plans. Now, guys, make sure that you are clearing your tuchus and make sure your insurers understand that this particular senior indemnity plan is a limited med plan that is going to pay that set dollar amount when the member receives a particular service. Please make sure they understand that this is not an Affordable Care Act plan. This does not offer the 10 essential health benefits that the Affordable Care Act plan offers. Why does the insured and the spouse both need to be over 65? Stephen, fabulous question. This particular product is geared towards our senior members, because remember, we have the NatGen Access, which takes them up to 64 years and 10 months. So again, we're bridging that little gap. So they must be senior, but we can have a dependent up to age 26. That was a great question. Thank you, Stephen. Now, guys, if you have questions, concerns, you aren't sure if your insured is going to qualify, email me. Email me. I'm here for you. You email me at the NatGen training or NGAH training at NGIC.com, and I'm super happy to help you at any time. Now, for those of you that are new to the senior indemnity products, so like the DVH, the dental vision hearing, again, geared towards our older populace, you are going to go to the enrollnatgen.com webpage. So that's where you're going to find this indemnity product for our seniors. Now you're going to log in with your NatGen back office. So let's say you can www.enrollnatgen.com, write it down, search for it, save it in your favorites, your bookmarks. But let's say you have problems logging in. Well, it happens. You can click on the forget user, and then you're going to receive an email along with the login instructions. If you're having serious issues and problems, you can always call agent support at 833-408-5392. So this is what the quote section looks like. Stephen, I will be right with you, I promise. So on the agent back office, on the ABO, just to make sure you guys understand, if you click on quote, you need to designate which one you want, the short-term supplemental or the Medicare supplemental. So using your ABO username and password, make sure you begin quote and then the enrolling. Again, designate which one, whether it's the short-term supplemental or the Medicare supplemental. So anything that is Medicare supplemental age 65, potentially and older. Well, the DVH is 55 and older. We also have the acceptance electronic signatures as well as telephonic. So it's a voice off process. So again, if you have questions, problems, if you're questioning if your insured is going to pass the underwriting questions, email me at any of questions you have on any of our product. I'm more than happy to help. Again, NGAH training at NGIC.com. So I'm going to say thank you. I appreciate you all and your time. So we'll check in with you guys later and we'll see you next time. Bye.